Hello and welcome everyone to our first seminar in the 2024 Disability Health Research Seminar Series. We are really delighted today to welcome Maria Town, who is President and CEO of the American Association of People with Disabilities, or the AAPD. My name is Jennifer Deal. I'm an associate professor at Johns Hopkins University and a faculty collaborator with the Johns Hopkins Disability Health Research Center that is directed by Dr. Bonnie Lynn Sweenor. It is really my pleasure to welcome you here today. I am a middle-aged woman with shoulder-length wavy blonde hair. I'm wearing glasses, a gray shirt, and a black suit jacket. I identify as cisgender, white, neurodivergent, and disabled. This is the first in a series of weekly seminars that we will hold over the next 6 weeks. We invite you to learn more about the Disability Health Research Center here at Johns Hopkins through our website, disabilityhealth.jhu.edu. The center also has a podcast called Included, the Disability Equity Podcast. That podcast is hosted by Dr. Sweenor, as well as Dr. Nicholas Reed, another faculty collaborator with the Disability Health Research Center. And you can find more information about the center and about the podcast on X, which is formerly Twitter, at JHU Disability and at Included Pod. We would like to begin today with a land acknowledgement. We recognize the enduring presence of more than 7,000 Indigenous peoples in Baltimore City, including the Piscataway, Lumbee, and Eastern Band of Cherokee community members. In terms of the logistics for today's webinar, we welcome questions at any time, but we will have a dedicated question and answer session at the end of today's webinar. We ask that you please use the Q&A function to ask any questions. Your message will be sent to the panelists, and then the moderator will ask the question on your behalf. CART and ASL are provided for this webinar, and we thank our ASL interpreters and our CART captioner today. Captions will be integrated into Zoom and can also be accessed through the stream text link in the chat. This webinar is being recorded, and if you do have any technical difficulties during the webinar, please reach out to us at epits4@jhmi.edu. That's EPITS4@jhmi.edu. And at this time, I'm really delighted to welcome our guest speaker for our fireside chat today. Maria Town is the President and CEO of the American Association of People with Disabilities. In this role, she works to increase the political and economic power of people with disabilities. She previously served as the director of the City of Houston Mayor's Office for People with Disabilities, where she advocated for the rights and needs of citizens with disabilities, served as a liaison between the mayor, city council, city departments, and other public and private entities on matters pertaining to people with disabilities in Houston, and established local and national partnerships to advance inclusion. Town is the former Senior Associate Director in the Obama White House Office of Public Engagement, where she managed the White House's engagement with the disability community and older Americans. She also managed a place-based portfolio and coordinated engagement across federal agencies. Town also worked as policy advisor at the Department of Labor's Office of Disability Employment Policy. She's led and coordinated numerous efforts to improve employment outcomes for youth and young adults with disabilities. She has particular expertise in areas of youth development and leadership and promoting college and career readiness for all youth. She is a member of the board of the Leadership Conference on Civil and Human Rights and is part of the inaugural class of the Ford Foundation Global Fellows. She comes from Louisiana, where her family still resides. Maria, thank you so much for joining us today. We're really, really grateful that you're here.
Thank you for having me. I'm so excited to be here and to kick off this fantastic seminar series.
Thank you. Thank you. We're excited to have you as our first speaker too. Thank you. I'm going to go ahead and just jump right in with some questions, and a reminder to our audience, if any questions come up as we go along, please put those in the Q&A and we'll be able to get to those at the end of the session today. So Maria, can you start by sharing the mission and charge of the American Association of People with Disabilities?
Absolutely, Jennifer. And before I get into this answer, I want to do a visual description of myself. I am a white woman with long brown hair. I'm wearing bold lipstick, a blue top, and pearls. My pronouns are she, her, and I'm coming to you all from Washington, D.C. on occupied Anacostan land. So Jennifer, thank you so much for asking me about the American Association of People with Disabilities, or AAPD. Just to give you some background, historically, people with disabilities were not only segregated from mainstream society, we were segregated from one another, right? There were institutions across the United States for specific types of disabilities. There were schools for the blind, schools for the deaf, institutions for people with psychiatric disabilities or intellectual disabilities. These types of institutions still exist. But that was a way of dividing disabled people's power. And one of the things that happened to pass the Americans with Disabilities Act, which is covers the whole of the disability community, was really pulling together different disability-specific community organizations to build our collective power as disabled people. And AAPD was really founded 5 years after the passage of the Americans with Disabilities Act to continue maintaining that cross-community organizing and to continue building our collective power. So today, AAPD focuses on advancing the political and economic power of the more than 61 million disabled people across the country. We are what's known as a disability-led organization. So all of our staff are people with disabilities, different types of disabilities. 75% of our board are people with disabilities, and all of our board's executive committee are people with disabilities. And again, as a point of context, historically, organizations that have focused on disability have not been led by disabled people. And we can have a whole conversation about the role of paternalism in the disability rights movement. We, again, are a cross-disability organization, and that means that we work on all kinds of issues. We don't focus on a specific disability identity or experience, although that kind of work is very important. And what this means for our day-to-day is that we often have to weigh a lot of different perspectives and sometimes even conflicting perspectives in order to take policy positions. And we execute a lot of our work both through advocacy and education efforts as well as programmatic efforts. So I want to especially note for the students who may be on this seminar, we offer we offer a number of programs focused on people with disabilities who are either current students or recent graduates. Two that I want to highlight are our fall and summer internship programs. And these are programs that place students and recent graduates in internships in federal agencies, on Capitol Hill, in disability nonprofits, and in other placements. You're paid, you're provided free accessible housing, technology stipend, and more. And participants are also connected with mentors and participate in what we call the Disability Advocacy Certificate Program. So they have opportunities to learn about systems advocacy, storytelling, and about key issues facing disabled people today. And it's an incredible program that I'm really proud of, if that's not obvious.
That's fantastic. Thank you. Thank you so much for mentioning that too, because I do know we have a number of students who would be interested in those opportunities, and the educational mission of what you do is so important too. So thank you for mentioning that. We know, and you talked a little bit already about how APPD is a leader in terms of advocating for important issues, critical issues, and policies that impact disabled people. Can you share some insight with us about a few of the most pressing challenges or issues right now?
This is such a huge question. And
Yeah, we're jumping right in there.
yeah,
Sorry.
um, I think it goes without saying that all issues are disability issues. And that's one of the things that makes this question so hard, because anything that we see happening, I could point to as being a critical disability issue. But to give us some focus, and because of my audience here, I actually think that one of our like most critical issues right now actually involves public health, and more broadly, the right for continued threats to the right of disabled people to exist in public safely. So let's first talk about the public health piece. Um, Public health has typically seen disability, and this is true for medicine and a lot of science as well. Public health has typically seen disability as an indicator of poor health or health disparity. And in some cases, that is true, right? When you see increases in the rate of asthma for people who live in public housing, or I'm, as my bio mentioned, I'm from Louisiana. My mom is specifically from an area, St. John the Baptist Parish. And when this small parish in rural Louisiana has the highest rates of cancer in the United States. And I see that in my family. And that is because of the chemical plants, right? The industry that the region relies on for its economy. But because of the way that public health has traditionally seen disability, when it came to addressing things like the ongoing COVID-19 pandemic, disabled people experienced and continue to experience significant barriers and ableism to getting access to the tools and supports we needed to survive. And that might sound a little bit hyperbolic, but it's not. There continue to be disabled people across the United States who continue to isolate because it is not safe for them to be in public with others who are no longer masking, who are not getting vaccinated, and who are not practicing social distancing themselves. And, AAPD has done a lot of work with the Centers for Disease Control and Prevention, and really pushed the agency to try to say, we can't go back to what you all are considering normal. I want to note that before COVID, during flu and cold season, people who were or are high risk really had to plead with family members to get vaccinated, right? So this whole thing around treating COVID as the flu does not make sense to us, and I think it reflects an overall kind of dismissal by a lot of public health officials of the experiences of disabled people. But more broadly, when I think about what it means to exist in public, I also, think about the risks of gun violence for students in classrooms, right? And what that means for disabled students who are told, don't evacuate, wait, and someone will come and find you. What a lot of people don't know is the classroom in Uvalde was a special education classroom. That's not covered in the news. And when I think about how hard people with disabilities have had to fight for the right to exist in public and be integrated through things like the Individuals with Disabilities Education Act or the ADA or the Rehabilitation Act, there are many days where I question, like, what is this fight for when we are continuing to have to just say we deserve to be here? And, at this point in time, so much of the human experience and identity is not only being politicized, it's being weaponized. So when we take this and look at it through the lens of being able to access reproductive health care or gender affirming care, and look at how that's impacting people with disabilities who are more likely to be trans or queer, and also more likely to have high-risk pregnancies or need to use technologies like IVF to build their families. Um, what's happening, right? And finally, this issue of like just existing in public also relates to the disinvestment that we've seen in our systems that support community integration of disabled people. So our healthcare system and Medicaid specifically has what we call an institutional bias, which means when you are insured through Medicaid and you need care, it is much easier to get Medicaid to pay for, excuse me, care inside a nursing home or another congregate setting than it is to get them to pay for care in your home, where you are more likely to have better health outcomes and live longer. And as always, families deserve to stay together. And going back to where I started, which was COVID, how many lives would have been saved if disabled people and older adults had been able to live in their homes and not be institutionalized in nursing homes? And until we both see improvements in things like pay for direct support workers and changes in our systems that actually create the access to home and community-based services, we're going to continue to see disabled people isolated in institutions and neglected. So that was a long answer to your question.
It was a hard question. That was a fantastic answer. Thank you. Of course, we really appreciate the focus on public health too, which is, very much what we're interested in as well. And I really do appreciate all of your thoughts on access and, something like the COVID-19 pandemic, as you mentioned, so many people have just considered that done and moved on and talking about the fallout as if it were something that is finished instead of something that is ongoing for so many Americans now. So really appreciate your perspectives on that. Thank you. This is primarily an audience of many academics, probably not all, but many. And so another question that we'd love to get your thoughts on is how can we as researchers and academics and students best support the efforts that you're doing? So we want to be inclusive of academics, and some may be focused on disability health specifically, but some may not. So, just thinking broadly, how can we try to include as many researchers as possible to support the work that you're doing?
I really appreciate this question. Like, it's just nice to be asked. So thank you. First, and this is going to sound very basic, but I would say talk to disabled people. And that, again, sounds kind of silly to say, but in my role, I can't tell you how often we'll have a organization, a policymaker, a corporate leader come to us and ask questions about an initiative. And our first question is, well, did you talk to any people with disabilities about this? And literally either they say no, or they say, we don't know where any disabled people are, or they'll say, this is my least favorite one. Why would we do that? Sometimes they say, well, we talked to parents or family members. And that none of that is acceptable. And I think so much research, so much academic study is actually focused on disability and yet does not center the experiences of disabled people themselves. And this is actually one of the reasons why we continue to see continued disparities across so many different disability types and such a lack of resources, particularly in the healthcare field around disabled adults like myself. Not to get too personal, I have cerebral palsy, which is sort of marked as a childhood disability. It's a developmental disability, so one that I've had since birth. And there is all kind of information about the experiences of pediatric patients with CP. But when you start digging into resources for adults with CP, they simply don't exist. And it's shocking because a lot of adults with CP exist, and we're happy to talk to you about what's happening to us, about our bodies and what we need. But the desire for that kind of dialogue is not there, or at least I've yet to see it. I think the other thing that can be so helpful is actually teaching disability material in your courses. And I want to talk about the importance of higher education in disability movements and in formation of disability identity. For so many people who come to disability at, let's say, a younger age, their first experience of disability community, disability pride, disability as an identity is in college, community college, university, or in graduate school. This is a story we hear all of the time at AAPD, and it is both amazing and also a problem, right? Because why is it that you're first learning about disability pride when you're 22? But because of that, higher education has often been a space where movements really start. And this is not just true for the disability community. This is true in a number of movements. But when we look at someone like Ed Roberts, who was the founder of the independent living movement, someone like Judy Heumann, her first disability organizing experience came because of discrimination in education. Ed Roberts founded a group called the Rolling Quads because the University of California at Berkeley had begun to accept disabled students and house them in the hospital. And so at AAPD, we really see colleges and universities as spaces where people with disabilities, whether they're young or non-traditional students who are older, can come to like figure stuff out and connect with folks. But those spaces need to be there. The willingness to have those dialogues needs to be there. For me, I came to college with a desire to learn about disability, having no sense of what that meant. So what did I take? I took biology courses because again, I thought it was an issue of the body. And I didn't realize that it was this larger issue with society until I was further along. And one of my, like at the time, the only other disabled professor that I knew gave me a memoir called Too Late to Die Young, which is a book by Harriet McBride Johnson that I suggest you all try out. And it was something that changed my life and changed my world. And I think facilitating more of those experiences for students, faculty, and staff is hugely helpful in a very broad way because it sustains the movement. Finally, I will say at AAPD, we really rely on research. And I know this gets into our next question, but to inform the positions that we take as an organization and to inform the kinds of conversations that we have with policymakers and other leaders. One of the things that we continually see as an issue is actually a real lack of research and content around disability experiences. And so we are constantly asking people to tell their stories, which is great. And one of the most precious gifts that we get as an organization is when someone is willing to share their story with us. But it does create a kind of burden of labor on disabled people to constantly tell our stories over and over again to even begin to get the basic things that we need. And I think working with academics, research leaders, and students to figure out other ways to get at that information can be very helpful.
Thank you. I really, really appreciate those perspectives. I'm thinking, just where you started out, just talking about by opening up a conversation and including disabled people as part of the research. And, from the very beginning, I think so much of the work we do, we want to ask very important consequential questions that will actually make a difference for people, but you can't ask the right questions if you're not talking to the right people to start with. So I appreciate everything you said. I think that really deeply resonated with me. And I think also about how closely public health has become tied with the medical system, with biology and the medical model of disability and everything. And so I also really very much appreciate this movement away from that and thinking much more broadly about how we age with a disability, rather than just thinking about disability as something that we should be preventing or just treating. So thank you. For our next question, so the Disability Health Research Center at Johns Hopkins is very focused on data. So understanding that there are gaps in disability data, trying to understand and fill those gaps. Could you please share your views on the connections between data and your organization's work? And are there places that you really think researchers should be focusing?
Yeah, so as I mentioned, data is vital to our work. Um, I'm so sorry. The sky just opened up here in DC, so there's a lot of rain and thunder happening in my background. Um, so we are constantly looking for data. We are constantly asked about data, and specifically data that is disaggregated in as many ways as you can imagine, whether that is around disability type, age, gender, race, sexual orientation, or location. And a lot of data that is disaggregated by all of those factors that I just provided often isn't available. So when we look at things like pay, and pay equity and disability, we can look at pay equity or lack thereof for disabled people compared to non-disabled people. We can look at it for disabled men compared to disabled women, and for, non-disabled men and women to disabled men and women. But once you get into race, and once you get into race and gender, those data just don't exist. So for example, if we wanted to examine the role that race plays amongst pay for disabled women, we don't really have a foundation of data to start from. And this similarly, because data is used in so many policy decisions, if there's not data on disability that is available to policymakers, disabled people don't show up in the policy solutions. And, we were very concerned about the recent proposed changes to the American Community Survey's disability questions. We worked closely with Dr. Sweener and many others to fight these proposed changes. For everyone's awareness, the census wanted to change what have been the standard 6 disability questions for a little over a decade, that are yes/no questions related to disability type, to a set of scaled questions where you would report if you experienced a scale from a little difficulty to a lot of difficulty on things like personal care, seeing, walking, or thinking. And if you sort of selected a little difficulty on a number of things, you would not count as disabled. And I want to be clear, there is no such thing as not disabled enough. I'm going to say it again so I don't mess up. There is no such thing as not disabled enough. You either are or you aren't. And most likely, if you think you aren't, you probably are. But anyway, so what we expected was that the number of overall people with disabilities in the United States would be reduced by as much as 40%. And I would go so far as to say even the current count of people with disabilities in the United States is an undercount, because there are just a ton of people who do not identify as having a disability, but they might say, I don't see as well as I used to, or I don't hear as well as I used to, right? So even we are constantly asking people to include disability in things like survey tools. There are a lot of misconceptions, in part because of what's in the ADA, that you can't ask about disability. And the reality is that you can, even in an employment setting, but you can make that disclosure optional. I also wanted to note that a kind of essentialism around data or an over-reliance on data can create problems as well. Disability is an incredibly diverse set of experiences. So, and that includes people with rare conditions. And this was a major issue during COVID and continues to be an issue. There were many groups of people representing kind of a larger group of folks with rare conditions who would say, we are high risk and need to be prioritized in things like vaccine distribution or personal protective equipment distribution. And the response they would get is, that's not showing up in the data. And the reality is the sample size of those populations is so small, it's not going to show up in the data. And because it wasn't showing up, they weren't getting prioritized. So we need to make sure that in any move around data we make, there is a continued awareness that it's never going to be, a data set on disability is never going to be comprehensive, because the reality is disability itself and experiences of disability are always changing and very contextual. So.
Yeah, thank you so much for that perspective. We talk a lot, many of us do work in large population-based data sets, and usually a lot of kind of the point of some of those is they're sampled in order to be nationally representative. But I think we tend to forget as researchers that they're nationally representative only so far as they sample on what they're purporting to be representative for. And disability is not something that's typically involved in that sampling. So I do appreciate that point in terms of the reliance on data, but then also this bigger idea, right, in terms of the changing identity and the diversity there too. So thank you for that perspective.
And I'll just add quickly too, this is an enormous issue when it comes to things like AI or algorithmic based decision tools. One, many of these tools are not trained on any kind of disability data set, so they're often very discriminatory. But I'll be clear, even if they were, the range of disability experiences and very importantly, preferences is so different that people with specific types of disabilities may become outliers and kind of rejected from the algorithms, because algorithms really don't like outliers. And so many, if not all, disabled people become outliers in that kind of data set. And I think it's a real problem that we have to figure out.
Thank you for adding that in. We didn't have a question specific to AI, but you've done some great work in that space. So I'm really glad that you brought that up. Thank you. For researchers and our students who are doing disability work, do you have any advice?
Thank you. Please remember that there are a lot of people who are very grateful that you're doing it, even when your institutions may not understand why it's so important. Community members do and think it's very important. Again, the advice to actually talk to disabled people. I can't say that enough. And what I think is really important, and I don't know, maybe I've done an okay job, but one of the things that I had to learn very quickly in my own career is that my personal experience was not enough. And at AAPD, we have to spend a lot of time learning about disability identities and experiences that are not our own. And so particularly if you are someone with a disability or you have a family member who is disabled and are really basing a lot of your study or research decisions off of your personal experience, that is a good thing. But push yourself to learn more, even in kind of the same disability diagnosis or category. Individuals who, let's say, have been blind since early childhood compared to individuals who became blind as a result of something like diabetes have vastly different relationships to their disabilities. Similarly, people with disabilities, even the same disability, they might have had access to different types of tools and systems. So their experiences, their needs, their desires are totally different day to day. And I think it can feel really overwhelming at times to figure all this out, and that is okay. The other thing that I'll say is if we are kind of all doing our jobs well, the the community continues to expand. And what that means is that there are going to be folks in spaces, whether that is classrooms or showing up in your research work, or showing up at meetings, who have never had the opportunity to do so before. And they may experience access barriers. There might be, in fact, an access conflict. And that is okay. Do not let that stop you. Don't beat yourself up about it, because inclusion is truly an iterative process. And there is no checklist that I can give you on creating inclusive content, for example, that will be fully representative of everyone who is going to encounter that information. I think the best thing that you can do is continue to keep an open mind and have a willingness to adapt. And one of the things that can really curtail so much progress is the thought, well, that's not the way it's been done before, right? And I think if you encounter yourself thinking that, or you encounter your institution thinking that, you should just ask why, right? Interrogate why things have been done the way they have been done. And what you'll find is they've never had to think about someone who is neurodivergent or who is both neurodivergent, blind, and COVID high risk. And admittedly, there will often not be a clear path with a clear, here's the right answer. And this is something that I'm confronted with constantly. And I just hope that if you ever feel like that, this is a moment when you reach out for community. In my opinion, one of the defining characteristics of disability in the United States is isolation, because we are a country that has exceptionalized individualism, and our systems and our economy are really built to prioritize and celebrate people as individuals and not support people in community with one another. And so we have to take time to build systems that are counter to that in order to support ourselves and support the ones that we love and support the communities that we are in. So that in moments where you are made to feel less than because you as an individual don't have the answers, you can reach out and get the support of friends or others in the disability community to help you figure it out, and who will also be there for you if you mess up, which will happen. So I hope that answers your question.
Yeah, that was incredible. Thank you. A lot to think about. I beautifully answered the question. Thank you. And I am keeping an eye on the time, and I realize that we have one more question left. And we have seen some questions come in through the Q&A. So at this time, I do invite you, if you have a question for Maria that has not yet been put in the Q&A, please do that now, and we'll be able to get to those very soon. So thank you. And as we wrap up, so our final question, where can our audience learn more about AAPD?
Sure. You can go to our website, aapd.com. Again, that's aapd.com. You can also follow us on social media on X, Facebook, Instagram, and LinkedIn. If anyone out there wants to help us start a TikTok, please let me know. But on X and Instagram, we are at AAPD, and on Facebook, we are Disability Powered. And on LinkedIn, I think you have to search our whole organization name.
Thank you. I will go ahead and then move on to the Q&A, and I'll go in the order that they have been received. So we have a question to start us out. So you as an experienced advocate, the question is coming from some student advocate who's interested in some starting tips, especially for people who are new to advocacy, who wish to challenge the ableism embedded within curriculum at schools broadly, and particularly related to health and public health.
This is an excellent question, and I actually wish we could open it up to hear some of what's happening for you all that's already happening. So I would say a couple of things. First, is be strategic. So you should know, for example, which professors might be opened to feeling a little bit challenged, and or which professors or maybe teaching assistants you feel comfortable with even saying, I think some of this course material might be ableist. Are you open to including other readings or other types of assignments? Maybe it's not the curriculum, maybe it's the way the course is designed. Having a conversation that says, the way that you've structured the deadlines around these assignments or the way that assignments have to be turned in is not accommodating to different types of learners. And I want to know, there are people who go into college or university knowing that they have a disability, working with a disability services or access office and getting accommodations, but there's a whole lot of people who don't know yet that they, for example, are neurodivergent or have a psychiatric disability or a learning disability until they get to college and really struggle. So building a curriculum through the lens of something called universal design for learning can be hugely beneficial to many students. And that is not about necessarily shifting the materials themselves, which some professors might take as a personal affront. I've had some experience with this. The other thing that I can't recommend enough is begin to look into public health researchers who are doing, I guess, disability positive work and come to those types of conversations prepared with suggesting alternatives. And this is a useful advocacy tactic in any environment. If I go to Capitol Hill and tell lawmakers that I don't like the way this particular piece of legislation addresses disability, the first thing they're going to ask me is, well, how do you think it should? And I have to be ready with prepared language or with suggestions. Otherwise, the conversation shuts down. So if you are willing to bring that up, I would say be prepared with some kind of materials or even suggestions of other educators to incorporate into curricula.
That's excellent advice. Thank you. There is a comment that says, I could not agree more in supporting everyone with disabilities. But when you embrace this, many may dismiss you because you're not embracing one disability over another. Are there any suggestions on what could be said here? And they let us know that there are women-owned small business and all with disabilities, and the owners also have a disability. So I think, you started out, I think this question came in early when you were talking about the importance of AAPD for thinking about bringing everyone together with the disability, but you also talked a little bit about some of the challenges with that too. So I think this comment and question is getting back to that.
Yeah, and I want to congratulate this person on having their own business. That's so, in my opinion, brave. So congratulations on doing that. Yeah, it's tough. One of the things that has, I think, caused a lot of harm is this idea of the hierarchy of disability. So this idea that some people are more disabled than others. And what we see, depending on the context, is that sometimes, people with mobility disabilities who use wheelchairs are kind of at the top of that hierarchy, and people who have disabilities that are not apparent, like ADHD, are at the bottom. And this is where we have people say things like, oh, I have chronic colitis, but I didn't think of myself as disabled because I don't really need anything like that. And it's like, okay, like I respect that that's your experience, but do you recognize that your colitis is causing you to have to shift the way that you work so that you can get infusions, or that you have to completely change the way you go about your day in order to manage your symptoms? All of that is a disability affecting an activity of daily living, which is how the Americans with Disabilities Act defines it. So I think in response to people sort of saying that you're not embracing one disability over another, I think it's important to acknowledge that disability is a natural part of the human experience, and that all of us, if we are lucky enough to live a long time, will become disabled. And so while it is really important to respect each individual's disability experiences, no one can prioritize one disability over another. It's just impossible to do. And I will note that there are some environments, I actually think school is a really good one, where some disability experiences may be kind of more disabling in particular ways, right? Blind students across the country continue to experience enormous delays in getting access to course content because either their textbooks or PDFs aren't accessible. And so they're forced to wait 2 to 3 months into a semester before they can even get the first assignment. But is that more like disabling, quote, than someone who gets the course content but has to struggle to understand it the whole time because their learning disability needs are not being met? So,
Thank you.
I don't know if that answers your question.
Yeah. No, I think it does, and this it's a great conversation, right? And just like a little more discussion and a little bit more thought around this issue.
Mhm.
So yes, absolutely. Thank you. There's a request for you to repeat the name of the book that you thought was so life-changing for you.
Yeah, it's called Too Late to Die Young. It's by Harriet McBride Johnson. She was a disability advocate based out of South Carolina. She had muscular dystrophy. And the book is essentially based on the premise that her whole life, because of her disability diagnosis, she was told that she would die very early, maybe in her teenage years. And she grew up watching things like the Jerry Lewis Muscular Dystrophy Association telethon that showed young children with muscular dystrophy and said, these poor children are going to die. And then she lived into adulthood and was faced with the question, well, what now? And it's a beautiful book about her experience. There are so many books out there that I think do a great job of really introducing people to disability. I'm going to go ahead and name a couple of more. One is Exile and Pride by Eli Clare. I think that this book is great, particularly for people with disabilities who also identify as LGBTQIA. Disability Visibility is another fantastic book. It's a collection of essays compiled and edited by Alice Wong. And then two more. One is a disability etiquette book by Emily Ladau. It's a very how do I have conversations about disability? Very straightforward. And then there's a newer book called Against Techno-Ableism, Rethinking Who Needs Improvement, and it's by Ashley Shue. The title sounds intimidating, but it's a very accessible book, and it addresses kind of how we think about technology, human improvement, and disability.
Thank you. I've got my reading list now for the next couple of months. This is wonderful. Thank you for sharing all of that. We have a comment that The participant really appreciated your discussion on how coming to disability identity in college is common, and says that was their experience as well. And then they ask, what are some ways that we can foster mentorship for people with disability?
I love this question too. All kinds of good questions. So I'm not exactly sure if by your question, you mean like fostering formal kind of mentorship programs for people with disabilities, or mentorship that is maybe more informal but based around disability identity. So I'll say a couple of things. I think for a lot of folks, the primary message that they get about their disability is that they need to pass somehow and kind of hide it or appear as sort of able-bodied, able-minded as possible. And what this causes is a kind of disassociation with disability and with wanting to connect to other disabled people. And so I think even being willing to talk to students, other staff, your colleagues about their disability in a positive way, and in an understanding and empathetic way is a great way to begin a kind of mentorship relationship. And the reason why I started where I did is just to acknowledge that there may be some people who don't want mentorship that centers around disability at a particular point in time. And you have to be open to that. And so figuring out how to meet people where they're at in terms of their identity is really important. If you are a graduate student, teaching assistant, research assistant, a professor yourself with a disability, I hope you know the power that can come with you disclosing that information to your students and to your colleagues. And that kind of disclosure, particularly if your institution is not accepting or accommodating, can come with risk. But for students and for work colleagues to see someone who is disabled, either leading their class or their research or in their space, can really begin to shift someone's thinking. I think setting up formal mentorships that focus on people with disabilities is very important. I think mentorship in general is very important. And sometimes we see disability being thought of in the context of diversity, but oftentimes we don't. So there can be a lot of, let's say, STEM mentorship programs for women or for people people from racial and ethnic minority backgrounds, but we have yet to see those same types of programs really be further developed for people with disabilities, and there's a huge need. I will also say, if you are not someone with a disability yourself, but identify as a disability ally, giving someone the space to explore their identity can be incredible. And I'll tell a part of my own story. When I was in college, I'd taken one formal class on disability, but that was it. And I wanted to learn more. And I approached a professor who I had a relationship with. I felt close with him and said, could I do an independent study on disability with you? And he said, Maria, I have no disability experience, but I'm up to do this with you. Can you help curate the stuff you want to learn, and we'll learn together? And I basically pulled together the reading list of my dreams, and we would sit down once a week and talk about what we learned, and I would have to write essays, and that became like an independent study. And he took that on, not because he knew anything about disability, but because he saw my desire to learn and wanted to be an active mentor to me. And I'm very grateful to him.
Thank you. That is amazing. Thank you for sharing that story with us. I think looking at the time, we probably have time for one more question. And I think this one is related on the topic of disclosure to what we were just talking about. And so um, the attendee writes that I often get asked if someone on the panel or the team has a disability. I have a chronic condition, which is listed as a disability in some places, but not all. I'm never sure how to respond to this question because of the ambiguity about whether my diagnosis should be considered a disability.
Mm. This is a very common experience, and so I'm very glad you asked this question. So, yes, your chronic condition is considered a disability, and it does not matter if it is listed in every place or not. It is always a disability all the time. And there is actually no one list of disabilities. So the Americans with Disabilities Act does not list disabling conditions or types of conditions. It instead defines a disability as a physical or mental impairment that affects an activity of daily living. So the emphasis within the ADA is not on the condition itself, it's how it impacts your ability to engage in the world. There is like a list of disabilities in the IDEA, but that is very different. And if it were up to me, I would change that law. But to my point, there's no one list. And the idea that there is somehow this like master comprehensive list of disabilities, I think gets us into a lot of trouble often. And so again, if you experience something that you believe is disabling, it's a disability. And that's enough. You do not have to have a formal diagnosis to be disabled. And this is another thing that people think. And it's part of actually the power that we have given the medical community and the health community generally to be the arbiters of disability. And I think today we're seeing a growing recognition of self-diagnosis, which is tricky sometimes, but very important. And I think especially for women and people of color, and trans people whose experiences have often been dismissed, or you're told to lose weight, like are their disability experiences are often underdiagnosed because of issues in things like medical research. So again, I will say, if you have an experience where something is changing the way that you engage with the world or connect with people, how you eat or understand information, all of that is disability. And you should feel free to claim it whenever you want to and whenever you feel safe to.
Maria, I really can't thank you enough for spending your time and your insights with us today. That this has really been fantastic. I'm so excited to hear about all the great work that you're doing at AAPD. And this really, I think, was a wonderful talk to start off the seminar series. So thank you again so much for joining us today. We're very grateful. We also want to thank our CART and ASL providers, as well as for the staff at the Disability Health Research Center for helping to organize this series. And we thank all of you for joining us today. We hope that you can join us again next week. Our next seminar will be on Thursday, April 11th from 3:30 to 4:30 p.m. Eastern US time. We will welcome Dr. Allison Cernick, who is the Deputy Director of the Eunice Kennedy Shriver National Institute of Child Health and Human Development. So we hope you can join us then. Thank you again, everyone. Take care. Goodbye.